I'm Dr. Bruce Deas. I'm the director of the emergency department at Healdsburg District Hospital. I was born in Healdsburg, so a lot of you might know that, or you might not know that, but I was born in the old hospital over on Johnson Street. It is no longer there, and we moved into this new hospital many years ago, and our new ER came out in 2008, so it's pretty modern. It's got all the up-to-date things that we need, and it's a great place to come get your care if you need it. So what I want to talk about today is kind of how to use our ER. I know that the ER can be somewhat intimidating at times. It's kind of a scary place to go unless you're working there every day like I am. But when you come to the ER, people often feel kind of uncomfortable. So I'm trying to figure out ways to make you feel more comfortable if you need to come to our ER. We hope you don't need to, but if you need to, come on in. Here's my brief user's manual for the emergency department. We're going to talk about three things. The first one is going to be, when should you come to the emergency department? What sort of situations? 2, if you're coming to the emergency department and you have time to plan, what things should you bring with you, or what should you think about before you come? And 3, what should you expect to happen during an emergency department stay? So let's start with number 1. When should you come to the emergency department? I know it seems sort of straightforward, but sometimes there's a lot of gray zones in this. So who gets to decide when you should come to the ER? The bottom line is you get to decide when you need to come to the emergency department. We want you to come only when it's necessary, but you get to define what is an emergency. The insurance companies use what they call the prudent layperson rule, which is if you are making this decision as a prudent normal person without medical knowledge, then they should cover your visit if you come to the emergency department for something that seems reasonable. Let's talk about some examples of reasons why they come to the emergency department. Sort of obvious things. 1, chest pain. Well, chest pain seems like you should definitely run to the emergency department, but if you just did about 25 push-ups yesterday and your chest muscles are sore, you probably don't need to come to the ER, especially if you're 18 years old. But any other chest pain, we'd like you to come to the ER, get checked out, because it's hard to know for sure what's going on with that, and it can be something very serious. Obviously, we're thinking about heart attacks, but there's lots of other things that can give you chest pain as well. 2, shortness of breath. Shortness of breath, if you're having difficulty breathing, especially in these times of COVID, then we think you should come to the emergency department because there's a lot of things that can be serious about that. Again, if that's a chronic thing, maybe not, but if it's something new and acute, you should come to the emergency department. The third thing is stroke symptoms. It's really important these days especially that you come to the emergency department if you have any symptoms that suggest you might have a stroke. Symptoms might be weakness or numbness on one side of your body, a droopy side of your face, difficulty with your speech or vision, dizziness or spinning vertigo-like feelings, anything that makes you worry that you might have a stroke. And there can certainly be other symptoms. You should get right in. We're lucky enough that Healdsburg is a stroke center and we can get you in, get you treated promptly, but we have a very limited amount of time and we need to get you there, do a bunch of tests really fast, and then get you treatment. But if you don't get in a reasonable period of time, then we can't get that done. Some other things that you might think about would be, of course, a laceration or cut of some sort that you think might need stitches. We're probably mostly the only game in town that does that. Broken bones, certainly of any significance, you should come to the emergency department. New significant pain of any sort, so if you had a new unusual sort of headache, that would worry us a little bit. We'd like to see you for that. Flank pain might suggest you have a kidney stone. Again, if it's mild, okay. But if it's bad enough that you think you need some care, come to the emergency department. In addition, if you have something like uncontrolled vomiting, you should come to the emergency department because sometimes you can get so weak and dehydrated that you need care. So let's talk about other reasons to come to the emergency department, and these are a little more vague. The bottom line is if you feel unsafe with your condition where you are, the emergency department might be a good choice. So if you have a chronic medical problem and symptoms have gotten significantly worse, the ER might be a good visit. If you don't have medical problems, but you have some new or worrying symptom of some sort, come to the emergency department. If you're feeling suicidal or depressed and you can't get other help, come to the emergency department. In addition, if anything is going on that you feel like you need help with and you aren't able to get medical care in a reasonable period of time, and I think this is really important. So even if you have a doctor, you have insurance, you have whatever, or you don't have a doctor, if you can't get to that doctor in a reasonable period of time and you think you need medical care, come to the emergency department and we can check you out. We're open 24/7. We're always available and we'll see anybody who comes in for any reason. Just briefly, when should you not come to the emergency department? Well, when you have a medical condition that's chronic, unchanged, or mild, and you don't really feel like you need urgent care right this minute, then there's no really reason to come to the emergency department. You can follow up with your doctor if you have access to your doctor. If you don't, then still you might end up having to come to the emergency department. Okay, so now you've decided to come to the emergency department. You're not in an emergency where you have to get there right away. You're calling an ambulance and you have time to think about this. Let's think about how you can plan what you can do before you come. But first, let's talk about maybe you do need to call an ambulance. If you need to call an ambulance, the situation might be something like where you have significant chest pain, you're feeling dizzy, lightheaded, you're having stroke symptoms, you're having trouble breathing, you have a severe injury and you can't move. Those are all situations where calling an ambulance is probably a good idea. And sometimes they can start some treatment even before you get to the emergency department. You also might need to call an ambulance just because you have no other way to get to the ER. And that's certainly a reasonable answer if you have a significant enough medical problem. Another thing to think about when you come into the emergency department is whether you should call your doctor or an advice nurse prior to coming in. They can save you trouble of having to come in sometimes, or they can also make it easier for insurance coverage if you've talked to somebody and they recommended you come to the emergency department. So consider that unless you're having a real emergency. All right, things to bring when you come to the emergency department. So first of all, the first and most important thing is if you have a list of your medications, if you have the bottles of your medications, just bring those with you because that's really helpful for us. We really need that information. It changes a lot of things about how we do things, and most people can't remember all of that. Secondly, if you have a list of medical problems, surgeries, any other past medical history, bring that information with you because that can be helpful. Thirdly, if you have a living will or any other piece of paper that describes you what your wishes are or a power of attorney, bring those with you because they can be really helpful as well. Sort of on a more practical basis, bring your cell phone and a charger. Sometimes we don't have a charger that matches your cell phone, and you often will need to get something like a phone number out of your cell phone that we can't access, so bring your cell phone and a charger. Also, since you might be there a while, bring a book or something else to keep you busy. Sometimes you just need something to keep you occupied while you're waiting for stuff to happen. Another thing that might be really helpful is to bring some support people like family and friends. It's nice to have them around for one, and secondly, it's also good to have somebody who can drive you home because sometimes you're going to need that person to drive you home if you get medications in an emergency department or if you have an injury that doesn't allow you to drive or you came in by ambulance. So consider bringing somebody else along. It's also helpful to bring somebody else along if there's some reason why you're not going to be able to give history and that person's going to know more about what you, and they can help us out. Sometimes that can be very, very helpful. And the last thing I mentioned to bring is your ID and insurance cards. They'll need those. We don't need those to get you started. We'll take care of you no matter what. But if you have an ID and insurance cards, that could be helpful as well. All right, third and final topic is what's going to happen when you get to the emergency department? Because if you haven't been there, you don't know how it works. So what's going to happen is you're going to walk in the front door. There's going to be a person behind the glass. That's our clerk. They're going to greet you. They're going to take some very brief information, your name, birth date, not much else. They're going to immediately contact a nurse. You probably won't spend any time in our waiting room because things are really fast in our ER in general. And then that nurse was going to come bring you back to a room. Once they get you to a room, they're going to do a whole bunch of things. They're going to weigh you. They're going to get your vital signs, take your blood pressure, those sorts of things. They're going to ask you a million questions about what brings you in, more about that, what past medical history, your medications, your allergies, those things that I asked you to bring with you. So it's easier to answer those if you've got them. And then they're going to ask you a number of questions about things which we ask everybody. They're going to ask about whether you feel safe at home or in your living environment, whether you're living in a home or you're homeless. They're going to ask you about symptoms of depression or suicidal thoughts. We ask those of everyone. It's not that we're particularly worried about you today, often, but it's just that we have to ask those of everybody. So once they've asked you all the questions, the nurse will contact the physician, get him in the room if he isn't in there already. A lot of times we're already in the room at that point. They will sometimes start some treatments like starting an IV, drawing blood or things like that. They'll get you ready to see the doctor. And once that's all done, the next step is me, the doctor comes in. Okay, the next thing that's going to happen is the physician's going to come in. He's probably going to have reviewed your records before he comes in. I do when I do that. And then he's going to come in, ask you a lot of the same questions that you were already asked to make sure we have the right answers. He's going to examine you and then discuss with you what findings we have and what the initial plan is. Often you can just get a medication and go home, or it may be that he'll already be able to tell you you need to be hospitalized or you need this done or that. But there should be a discussion about what things are going to happen next. They may order medications, they might start some other sort of treatment, they might do a procedure like repair a laceration right then. He might order x-rays, might order IV fluids or antibiotics. There's a lot of things that they might order initially, but again, they should discuss that with you and make that plan. After that, the physician's going to leave the room, go out, place orders in the chart, probably do some documenting, and then get everything rolling so that all your care takes place. They will communicate with the nurse, of course. After that, once they have results back, they'll review those results, come back and talk to you, come back and do whatever procedures need to be done. At that point, the decision will be made about where things go from here. And it may be that it's time to send you home, it may be it's time to do something else, time to do other studies. Remember, ask questions. I know you can't ask questions on this recording, but ask questions anytime you have a question. So let's talk about timing. So now you've seen the nurse, the doctor, things are starting to happen. How long is this log going to take? Well, it takes about 10 minutes from the average time that someone gets registered to the physician sees them. So we're really fast there. So you're really lucky in that regard. Coming to a small hospital like this is good. After that, it's going to take, on average, for all ER patients, about an hour and a half to 2 hours for their overall care. Now, there's going to be a wide range. Some people will be very brief. You might be there for half an hour. Other people will be there much longer, depending on the kinds of treatment that they need. Now, if you're going to have x-rays or lab tests, you can expect that to be 2 or 3 hours. If you have any sorts of treatment like IV fluids or medications, that usually takes a couple of hours. It's important to know that x-rays are done by the x-ray department, and they're often read by radiologists if they're complicated x-rays. So if they are going to do that, it's going to take maybe up to an hour after you have your x-rays done to have a result back from that. So be prepared to do some waiting at those times. Also, if you end up getting admitted to the hospital, it's common for that to take a few hours just because we have to do all our initial testing, and then there's a process of getting you admitted to the hospital. So it's going to take a little bit of time. Again, be aware, people are going to ask you the same questions over and over again. They're going to ask you your name and your date of birth every time they want to do something because we're confirming your identity. So don't be surprised by that. So once things have been completed, the physician should come back in, talk to you about the findings, discuss plans, come up with a plan for follow-up if you're going home, discuss whether or not you think you need to be in the hospital or he thinks you need to be in the hospital, and come up with an overall plan for sending you home usually. They will hopefully have that discussion with you. Again, this is a great time to ask questions. Then the doctor will go out, write some more orders, write the discharge paperwork. The nurse will come in, unhook you from everything, do last set of vital signs usually, and then they will go over the discharge paperwork, talk about when you need to follow up, who you need to follow up, when you should return to the emergency department if something changes. And once you have all that information, you're pretty much done. Of course, at this point, you also need to figure out how you're getting home. So if you brought a driver, that's helpful. And you should be sure, again, ask questions. Every time you turn around, if you have anything that's a concern, ask a question. So I guess that's pretty much how a trip to the ER works. I hope that this was helpful in some way. I just want you to know that having an ER locally here in town is a great benefit. I hope you support our hospital as much as you can. We don't want you to come in all the time because we want you to be well, but if you need to come to a hospital, we can certainly take care of any needs you have. Thanks for your time.